Dr. Bob, why do people get high blood pressure? Well, that seems like a very simple question. Normally I would say, well, you get hardening of the arteries and you get high blood pressure, but that's not really the case. 90% of high blood pressure, we don't know the cause. We're too stupid. Doctors in medicine are, we hate to say that though. It's called essential hypertension. The other causes of high blood pressure could be some tumors in the adrenal gland or narrowing of the blood supply to the kidney. All of those can produce hormones that cause elevated blood pressure. But the most common cause is hardening of the arteries. It's atherosclerosis, we call it. And that's where cholesterol is deposited into the blood vessels, and the blood vessels, instead of becoming nice and wiggly and pliable, become very stiff and very hard. And the heart has to beat blood past those. It therefore has to create a higher pressure to get the blood going through those blood vessels. There's a lot of things that you can do about that. We can lower blood pressure by exercising. We always say in the Dr. Bob Show that we need to be exercising, and we need to do 30 minutes at least, and we need to do it 6 or 7 days every week. When we exercise, we can lower the blood pressure some 7 or 8 points with regular exercise. We can watch the amount of salt that we have in our diet. There are some people that are very salt sensitive as far as high blood pressure goes. So cut down on the salt. Learn which foods have most salt in them. Stay away from those foods. Keep the salt shaker off the table. Talk to your doctor about a DASH, D-A-S-H diet. That's a sodium restricted diet. It may help that blood pressure. Lose weight. The heavier we are, the more difficulty it is for that heart to pump blood that's going through our body. So there are lots of things that we can do. Your cholesterol level. If your cholesterol is elevated, it's going to be depositing into the blood vessels. It's going to make those blood vessels hardened. So know what your cholesterol is. The good cholesterol, we call it the HDL. If we can elevate the HDL, it actually can go into the vessels and take away some of those cholesterol plaques. The lousy cholesterol, the LDL, we want to lower it so we won't get any new plaques. Talk to your doctor about a plan if you've got high blood pressure. Be sure you have a home blood pressure cuff so you can be taking your blood pressure at home, record it, put it down on a piece of paper, take it to your doctor every time you go. And if you go to other doctors than your primary care physician, be sure they take your blood pressure and you bring back those results. Good luck on your blood pressure. Real problem, 74 million people in the United States have blood pressure, and a lot of those really are not under good control.